Hello again, everyone. My name is Marty Guthmiller, and I'm the CEO at Orange City Area Health System, bringing you today the 25th edition of our COVID-19 community briefing. I thought I'd shake it up a little bit today and come with a little different camera angle, so hopefully that's acceptable to you. What I'd like to do today is start off with our traditional stuff with the scoreboard, presenting the number of tests done here at the health system. That number now is at 282. We have 21 positives of the 282 for a 7.4% positive rate. So for those of you keeping score at home, that rate has been going down, and we're expecting it to go down as our number of tests go up. We do have 15 tests positive or pending also right now. But the main thing is 21 positives out of 282, and that positive rate is trending in the right direction. At the Sioux County level, again, trending in the right direction. We've done 1,486 tests. 286 of them are positive for a rate of 19.2%. That rate before was 20.2%, and so again, as expected, as our test numbers go up and our positives basically increase at an incremental rate, the overall rate is going down, and we are experiencing that. 1 out of every 23 Sioux County residents have been tested at this point. Stepping up a level again from the local to the county to the region, Region 3, 20 hospitals or 20 counties in northwest Iowa, 87%, I'm sorry, getting ahead of myself today, 87 hospitalized patients in Region 3. Yesterday, that number was 94, the day before 97. And so again, in Region 3, the number of hospitalizations has gone 97, 94, 87. So again, trending in the right direction. Another indicator in Region 3 is the last 24-hour hospital admissions. In the last 24 hours in Region 3, it's been 6. Yesterday, that number was 3, and the day before is 8. So that's just another gauge, but again, not as primary of a gauge as the total number of hospitalizations. In terms of ICU patients in Region 3, pretty static at this point, 43 today. That is 45 as compared to 45 yesterday and 45 the day before. Stepping up one more level now to the state of Iowa, the positives, as reported today on coronavirus.iowa.gov website, is 20,010 positive COVID-19 tests. That's a 12.2% positive rate. That number was 12.4. So at a state level, we're seeing a decreased number of positive as a percentage as well. 1 out of every 19 Iowans has been tested. That number continues to shrink as well. There have been 566 deaths in the state of Iowa. So again, a very serious matter that we're dealing with. Looked at a couple of the demographics on the number of deaths, and 98% of the deaths in Iowa were age 41 and above, 98%. 87% of those deaths were 61 and above. So again, this is not affecting the younger folks as it could have, and we're very grateful for that. And the statistics are definitely confirming that in Iowa. Another stat that I've been providing to everybody is the number of hospitalizations. I think that's a pretty good indication of the seriousness or the acuteness of the outbreak. In Iowa, we currently have 292 hospitalizations. At our last briefing, that number was 334. So we've dropped down a very nice an amount from 334 to 292. So that's a very positive thing. In Sioux County, we have 0 hospitalizations, as well as in Lyon and O'Brien County, still 0. Plymouth County has reduced from 4 the last time we talked to 3 today. Woodbury County is staying the same at 44. Polk County in Des Moines area has dropped to 85. The last number we talked about there was 104. So a very significant drop of almost 20% in the Polk County area. Buena Vista County, that we've been monitoring also as well, it stayed the same at 14. So that's a constant there. So hopefully that gives you a little bit of an overview. At the local level, we're at a 7.4% positive rate. At the county level, we're at a 19.2% rate. And at the state level, we're at a 12.2% rate. Things are trending in the right direction. We're not out of it yet, but they are trending in the right direction. And many of the positives that we're seeing, as a reminder, are not acute enough or not serious enough to require hospitalization, which is another good thing. I'm a bit of a broken record on this point, but it's so important that I need to remind you all to make sure that you stay current with your health maintenance kinds of things. We don't want the neglect of those things to end up harming more people than COVID-19 did. And so please stay current with that, whatever that might be. Again, blood pressure, diabetes management, various kinds of screenings. Make sure that you take care of yourself. Make sure you keep your kids' immunizations up as well. One of the things that we don't want as a tragedy is an outbreak of preventable disease amongst children in this. And so please keep your vaccinations current. Please make sure that you get those taken care of wherever your provider is. Keep controlling what you can control, and try not to worry about all the things that we can't control. Just control what you control, focus on that. And again, I remind you to stay vigilant, to stay strong, and to stay healthy. Thank you for joining us for this briefing.